Good evening, everyone, and welcome to the NAACP's Prostate Cancer and Breast Cancer Awareness presentation. That's going to be presented by some really talented people that's going to talk about some very important issues related to breast cancer and prostate cancer. We also have a few elected leaders that are going to speak tonight. Once again, my name is Fred Taylor. I'm the president of the Worcester branch NAACP. I'd like to welcome everyone to this event. I'd like to lead off by introducing someone who's making a special appearance here that's in Washington. I want to give Congressman Jim Manogram the floor. I'd like to introduce him. Thank you very much, Congressman. We appreciate you taking the time to be here tonight.
Well, thanks, Fred, and thank you all for having me at this important event. But I first want to congratulate my good friend, Fred Taylor, on receiving the Massachusetts Black and Latino Legislative Caucus Black Excellence on the Hill Award. This is such an amazing and well-deserved honor. You're an incredible champion for the city of Worcester and for all good causes, and I'm proud to work beside you. And again, I think I speak for everybody when I say congratulations. But look at prostate and breast cancer are two of the most common cancers in America. And the truth is their incidences are highest amongst Black men and women. Health disparities in Black and brown communities have persisted in this country as a result of structural, environmental, and economic racism. Inequalities in medical access and treatment have meant that while cancer rates and mortality have decreased across the board over the last decade, cancer is still most prevalent and most deadly for Black Americans. And the pandemic created many delays when it comes to cancer-related testing and follow-up care. A lot of people didn't go and get checked out. Thankfully, we're in a much better place than we were 3 years ago, and we're even coming up on the official end of the emergency declaration later this week. So I'm relieved by all of this, but we still have miles to go when it comes to getting people access to the resources needed to detect and prevent these cancers early. Most people know firsthand the devastating impact of cancer, and Black families have experienced this pain disproportionately. And we have to do everything we can to raise awareness and advance science when it comes to cancer and cancer research. And that starts with events like this. So I've been happy to see the Biden administration prioritize health equity in the Reignited Cancer Moonshot Initiative. And I'm committed to supporting those efforts to the best of my ability. I'm going to continue to fight for increased access to preventative care services, diversity in clinical trials, and cancer education, because the color of your skin should not determine your health outcomes. As some of you may know, my wife, Lisa, works for an organization called the Prevent Cancer Foundation. And prevention and early detection is so essential to combating both these cancers that we're talking about. So we need to do everything we can to help demystify, getting checkups, and we need to make sure that we are having available to people easy access to these kind of checkups. So thank you all again for having me and putting me on such an amazing event. I look forward to continuing this important work together. And again, this is important. Because this gathering here could very well save lives. So with that, I thank you, Fred. Congratulations again. And the buzzers you hear in the background are calls for votes. So that's what it's not a fire alarm. We have votes. So anyway. All
right. Well, thank you. Thank you, and continue to represent us well. We really appreciate having you as our representative in Worcester and in the country. Thank you.
Thank you, Ben.
So Congressman McGovern just came on for a few minutes. As you can hear that. He's in Washington, D.C. He's making some really important votes. The bell's ringing. He's got to run back. Actually, he's in the Capitol building now, but he's got to go to the floor to make some votes. I want to recognize State Representative Jim O'Day, who's on the call today. Thank you very much, Jim. We appreciate your support. We appreciate you taking the time to come and join us tonight. Thank you, and thank you to everyone who's on the call tonight. This is an important event. And we really appreciate having the support of all of you for this very important organization. Without further ado, I'd like to introduce Commissioner Maddie Castile. Commissioner Maddie Castile is going to talk about the metrics in Worcester related to prostate cancer. She's a commissioner of Health and Human Services, for some of you who don't know, for the city of Worcester. She also works for UMass Memorial. Without further ado, I'd like to introduce Commissioner Castillo.
Thank you, Fred. I appreciate it. I'm thrilled to be here with all of you tonight. And I just want to start by talking about that the inequities that do exist in that we see with everything regarding in healthcare, and in particular, when we're talking about prostate and breast cancer. And I guess, you know, and you can see on the slide here, we talk about reality, what we really do see, that one person gets more than is needed while the other gets less than is needed. We do a lot of talking about equality, and really what people are talking about more now is equity. And that's everyone gets the same support they need, which produces equity. But we don't want to just go there. What we want to be able to say is that everybody, we want justice. And so let's move from equity to say justice, that all three of the kids who are here can see the same game without supports or accommodations, because the causes have been of the inequity have been addressed. And that's what we need to move on to be able to do. And this, I show this slide because we spend most of our time here dealing with communicable diseases, chronic diseases. We spend time really looking at behaviors that people have, and how do we deal with those behaviors, which these behaviors move on to cause the issues here and ultimately mortality. But we don't look here. And these are the things that are needed to really improve healthcare. So we talk about the social environment. We talk about racism overall, violence in our community, really also the social determinants of health, transportation, housing, all of these things that we are not paying attention to. We are one of the richest countries in the world, and yes, and yet we lack on the social services that need to be done in our country. We have institutional inequities, and we have also social inequities. All of these things, if we were to improve these, certainly our outcomes would be a lot better. When we talk about the social determinants of health, we say it's the circumstances in which people are born, they grow, they live, they work, and age. And these circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. And that is a huge piece for our community. We know that in particular in Worcester, Black and brown communities live in areas that have the least justice in those areas. When we talk about housing, when we talk about transportation, when we talk about jobs, that is truly what happens in those areas. And all of that is caused by structural racism. And that is truly what we need to change. That's a tall order, but that's what we need to be working on. And structural racism is a totality of ways in which societies foster racial discrimination through mutually reinforcing inequitable systems that in turn reinforce discriminatory beliefs, values, and distribution of resources, which together affect the risk of adverse health outcomes. And when we look at those health outcomes, we can see what the life expectancy is like for people who live on the west side of our city and on Kelly Square. Kelly Square, the life expectancy is 72.9 years, and you just go down a few miles out to the west side, and life expectancy is 84 years. This is why this is what causes, this is the outcome of the inequities that we see in healthcare. And when we look overall, I'm from Cuba, and we thought that healthcare wasn't the same, that USA had the best healthcare. But look at our neighbors, our neighborhoods down here. Cuba is 78.5% life expectancy at birth, and Union Hill has 71.6%. Worcester, Maine South, less than that at 74.1. And then when we look at how much we spend, and that's what I was talking about, how much we spend on healthcare, we spend the most in healthcare, and yet have some of the worst outcomes that we can see. And that is truly a piece of what we call social determinants of health. Not looking at that, not paying attention to that, but partly because all of that has been caused by racism. So despite having the most expensive healthcare system, the United States ranks last overall compared with 6 other industrialized countries, Australia, Canada, Germany, the Netherlands, New Zealand, and the United Kingdom, on measures of quality, efficiency, access to care, equity, and the ability to lead long, healthy lives. So cancer is the second leading cause of death in the United States, exceeded only by heart disease, and 1 out of every 5 deaths in the United States is due to cancer. So when we're talking about prostate cancer in Massachusetts overall, all races, we see that the rate of new prostate cancer exceeds that of all other cancers, including lung and colon cancers for males of all races. Black non-Hispanic men, pictured here, are 2 times as likely to have prostate cancer compared with white, non-Hispanic, and Hispanic men. When we're looking at top 10 cancers by rates of cancer deaths, and this is here, overall prostate cancer is the second deadliest form of cancer among men in all races in the state. And then when we look at in the Latino community, we see where that prostate cancer is 4th deadliest in the Latino community. And when we look at non-Hispanic, we see that it's the second deadliest form of cancer, but look at the rates of difference from 38.1. So it's the 4th in Latino men. It's the second deadliest form of cancer among white men, 38.1 compared to 78.8 per 100,000. And then when we look at the Black community, the Black men in particular, it is the deadliest form of cancer among Black men in the United States. And you can see the difference, the rate here at 34 per 100,000. And when we look at breast cancer, we see sort of the same similarities, that overall, the rate of new breast cancer cases exceeds that of all other cancers at 137.7 per 100,000. And that's including lung and colon cancers for females of all races in the state. And then when we look at Black, non-Hispanic females, they have the highest rate of breast cancer compared to their counterparts. And this is 146 per 100,000. Overall, breast cancer is the second deadliest form of cancer among females of all races in the state. But yet in Black non-Hispanic females, they have the highest rate of breast cancer deaths compared to their counterparts. So you can see that it is disproportionate in the Black community for both breast cancer and for prostate cancer. Thank you.
Thank you very much. At this time, I'd like to recognize State Senator Robin Kennedy. Thank you for joining us. Your colleagues should be joining us in about 10 to 15 minutes, but I just wanted to recognize you. Thank you, Robin. We appreciate your support. We appreciate you taking the time to come here and be with us tonight on this important presentation on healthcare. Thank you. Without further ado, I'd like to pass the baton over to Nakia Clark, the Ellie Fund. She's going to talk about all the advancements and the support that Ellie Fund provides to people who are suffering and families who are dealing with breast cancer. So without further ado, I'd like to introduce Nakia Clark.
Hello, everyone, and thank you for inviting me to this event. I have some slides that I can share with you. Okay, so first I want to talk about as Dr. Castile said about the disparities with women with breast cancer. And in the US, it's 1 in 8 women who will be diagnosed with breast cancer. So for me, I'm that 1 in 8. I was diagnosed with breast cancer almost 5 years ago. And my mom also had breast cancer, but unfortunately she passed away in 2020 from metastatic breast cancer. So this is very near and dear to me personally, and also for me to give back to the community. So this slide that you're seeing here is the referral sources that we receive. Dana-Farber is one of our top hospitals that we receive referrals for patients, but we're trying to branch out to community health centers and different organizations and just word of mouth as to our services. And here is a chart of patients that we serve. And as you can see, there was a dip in 2020 due to the pandemic. But as of 2022, we have served over 1,000 patients. And the only eligibility that we require is that a patient is either living in Massachusetts or is receiving treatment in Massachusetts, and they're in current active treatment. We are need blind, so we don't ask for income or any proof of residency. As long as you meet those 2 criteria, we would be able to provide services to you. And we have separate grants. One is for 3 months, and that's with our patients who are non-metastatic or stages 0 to 3. And then 6 months for our metastatic stage 4 breast cancer patients. And all of our patients can receive a maximum of 2 of the services. And I'll go into detail as to what the services we provide. This is our most popular is grocery. So we would provide grocery gift cards to patients and their families each month. And it could be any grocery store of their choice. So it's not tied to one grocery store. If they would like to go to Market Basket or Big Y, wherever it's in their area, we would provide the gift cards for them on a monthly basis. We also provide meal delivery in 2 ways. It's traditional where we partner with a restaurant. It's called Dream Dinners, and they provide nutritious meals for the household, and they get delivered by Ellie Fund volunteers on a monthly basis. And then they can only go within an hour radius of our office, which is in Needham. So we also offer, it's called New Tray Meals, and it's an online service where patients can go online and pick meals from, again, a nutritious, they're all local, and they get delivered on a weekly basis. We also offer gift cards for transportation to and from their appointments. So that would be in the form of a gas gift card, Uber or Lyft cards. If the patient utilizes the ride, we can add money to their account for the ride. We reimburse for parking and local taxi companies. So all of that tied to transportation so that there isn't any barriers for the patients to get to their treatment. We also offer light housekeeping. We partner with the local housekeeping service, and they will come in and do light dusting, mopping, sweeping, so that the patient can have a nice clean place after going through their treatments. One of our other services we offer is reimbursement towards childcare. We would pay for if it's after school, if it's summer programs, some tutoring, we would provide partial reimbursement for the patient in the form of, they would just need to send in either an invoice or a receipt, and then we would reimburse them for that cost. And then our last services are integrative therapies, and that's either in the form of oncology massage or acupuncture. We will, again, reimburse the patient for those services. A lot of times when they're going through treatment, their bodies just are not feeling well. And it's nice for them to just go and have a massage or acupuncture, and we would reimburse for that. We don't have oncology massage or acupuncturists, but we do recommend people in the area, and we could also reimburse for that. And so our application process is very simple. They can either be referred, as I showed in the first slide, through their medical office. But as of October, we've initiated the self-referral application where the patient can take control on their own and refer themselves to us. They can fill out the application, and we will process it for them to receive services from us. And that is the end of my presentation. And we're on social media through Facebook, LinkedIn, Twitter, and on Instagram.
Thank you very much, Zakia. Yeah, there's the contact information if anyone's interested. Reach out to us. Some really good services. When we had her come in and speak to our membership last year, everyone was very excited. It was very informative, very educational. We really liked it, and I hope you did too. Again, her information is online, was just showed up. And if you're interested, send an email to the NAACP website, or if you don't mind, Nikki, if you could just put your information in the chat. And if anyone wants to reach out to you, they can get it that way also.
Yes, I can do that.
Okay. At this time, I'd like to recognize Governor Council member Paul DiPaolo. Thank you for stopping in, Paul. We really appreciate you taking the time to join us tonight. Thank you very much. We appreciate it.
Hey, Fred. Sorry I'm late.
No problem. Better late than never, right?
That's right.
So at this time, I'd like to introduce someone who's been working with Dr. Stern, educating the people on prostate cancer. He does a really good job of explaining talking about prostate cancer, educating us on screening and diagnosing prostate cancer. He works for UMass Memorial. So without further ado, I'd like to recognize and introduce Dr. Mitchell Sokoloff.
Fred, thank you very much for the introduction, and thank you everyone for enabling me to speak today. It's really a pleasure and an honor to discuss prostate cancer, especially in the underserved populations. And I'm going to follow up from exactly where Dr. Castillo left off, in that, there is a tremendous amount of healthcare disparities when it comes to prostate cancer, social determinants of health, political determinants of health, which is much more on the racism side. And it's a population, African-American men particularly, and also Hispanic Americans, but the African populations, and just making sure that they get access and education and the ability to get proper prostate cancer awareness and treatment. So I've now been in Worcester, I think I'm coming up on 9 years, believe it or not, of which I've partnered with, or I should say, Dr. Stern has invited me to partner with her. She's the tour de force in all of this. But for the last 8 years, I've been in Worcester. I've been running our prostate cancer program, as well as the Department of Urology. I am the chair. And when I got here, Dr. Stern sent me some wonderful slides, which really showed that Worcester County was kind of ground zero for prostate cancer problems within the state of Massachusetts. There's some great statistics I still use from when I got here, but the incidence in African-American men being 2.5 times greater than that in Caucasian men, and the mortality being about the same, 2.5 times. More recent data actually shows that this part of the state has gotten better, that we've done some work on introducing people to the issue, to getting the word out, to spreading it. And actually, if you go west to the Springfield area, that's where most of the issues are. But what were those interventions? Outreach, going out and speaking to advocacy group, cultural group, religious groups, teaching people about prostate cancer, making them aware that it's a problem in these underserved population. And then the next step is access, making sure that we can get them into our clinical practice at the University of Massachusetts. And we're fortunate in that we really have the latest top of class diagnostics and therapeutics, so we can really enable people not only to get educated, but also to get state-of-the-art treatments. So let's start on those treatments, because I think that's what Dr. Stern originally asked me to speak on. And it all starts with screening and diagnosis. It all starts at the very beginning. We need to be able to get patients in to get screened, targeting these patient populations, and providing the correct panel of tests. We've got blood tests, we've got urinary tests. Depending on some of the initial results, we can go to secondary and third studies and evaluations. We've got imaging studies. We've got all sorts of things we can use to make sure that we're screening the population the correct way. Precision diagnostics, which is something AdMeTech, Dr. Stern's organization, has really been at the forefront forever, is trying to combine those most effective combinations of laboratory, radiologic, and pathologic tests. So that's where it all starts, and being able to offer all of that. Then it's getting patients into the clinic, which we've done a pretty good job. If we actually get through that diagnostic and we make a diagnosis of prostate cancer, the real issues come in on stratifying patients and making sure that we are offering the appropriate treatment for the appropriate aggressiveness of the disease. I counseled 4 people today. It's an hour-long conversation with these really long decision trees. But basically, now in the current world, we can offer everything from surveillance, where we just observe a person, monitor a person, follow them, not necessarily treat them until something progresses or becomes worse. And often those people can live their entire lives without needing more intervention. Something that always makes Dr. Stern and me smile is really lately the dissemination of what's called focal therapy. So instead of the traditional treatments where you either remove or radiate the entire prostate, we can now sort of select an area of it, if there's just a very small focus of cancer, and very effectively treat that. high intensity focused ultrasound is kind of the current treatment for that. We just got the latest version here at UMass, but it's something that's been slowly populating into the academic centers within Massachusetts and enables people to treat a small area of cancer without all the side effects that are involved when you treat the entire prostate. Obviously, those entire prostate treatments, surgery, radiation, are still used quite often. These are for patients who might have more aggressive disease, might have a larger volume of disease within the prostate. And again, there are newer technologies for both of these. Our radiation oncologists have gotten to the point where they have shortened the treatments from 8 weeks to 4 weeks or 5 weeks. They've done better with seeds, where you place little tiny radioactive seeds to very effectively treat it. With surgery, we've got robotic surgery, and within robotic, we've got single port, multi-port, all these ways of really minimizing the stress and the trauma to the patient, yet effectively treating the cancer and trying to minimize those side effects that we all want to avoid in our patient. And then the biggest growth overall, and this has been going on in the 30 years since I've been involved in prostate cancer, is for that unfortunate patient who has metastatic disease, where the cancer has spread to other parts of the body. When I was finishing residency and fellowship in the 90s, the treatments were basically the same as they were in 1944, where it was discovered that if you can manipulate the hormone testosterone, you can put prostate cancer into remission. And that has remained a mainstay today, but that was kind of it when I finished my residency and training. That was only about 20-25 years ago. Now we've got all sorts of different treatments. There are some similar to chemotherapy. There's some that interfere with proteins. There's some that interfere with DNA. It's a field that has grown exponentially every year, so that for that patient who might have skipped that early or missed that early screening for whatever reason, we can now very effectively treat advanced disease and give them survival for many, many years. So once someone is diagnosed, and again, we're starting with that access, once we make a diagnosis, we can really stratify a patient, and then we can offer them one of these several different buckets of treatment so that we can effectively cure their cancer or treat it, while at the same time minimizing those side effects. So where does it start, as I mentioned? And this is a segue into Dr. Stern's talk. It's improving access to care and awareness. And Central Massachusetts has a very is situated in a unique way in that there are a lot of expatriate African communities, Afro-Caribbean communities, and American-born African-American populations. And these are those underserved populations that Dr. Castile mentioned, where not only is the risk of prostate cancer higher and the aggressiveness of prostate cancer higher, but there's often a delay in diagnosis, there's a delay in treatment because access to medical centers like UMass is delayed. Our community here of those expatriate African and Afro-Caribbean men really reflects an immigration pattern from countries. And if I'm not using slides, but if I did, I could show you this map of the world, and there are all these red spots, and those are going to be in the Caribbean and Western Africa and Central Africa, obviously a very high or a source of a lot of our population here in Central Mass. And as Dr. Castile said, access is challenged by the social and political determinants of health, access, awareness, education, and that's where we get out and try to get the word out. Dr. Stern is going to talk in a few minutes about the Prostate Cancer Equity Program, so I don't want to steal her thunder, but it is a way where she has partnered with many of us in the communities, especially the academic communities, to advance and assure access for best-in-class care for men with prostate cancer. And again, it all starts with that awareness and education. It then goes to enabling those underserved populations access to the centers that we all partner with, so they get access to state-of-the-art diagnostics and therapeutics. And then we can offer them just a sort of a smorgasbord of treatments, each one tailored for an individual. As I told my patients today, the whole goal of prostate cancer evaluation and treatment is to really personalize that care, get the best treatment for that individual patient. Some people need, advanced drug therapy. Some people need robotic surgery or radiation. Some people can just sort of follow and monitor their cancers. And we are at a state now within academic urology where in oncology, where we can really get those best treatments to that patient. It's making sure they get in the door. It's making sure they get educated, they're aware, and that we can provide them with that care. So I think, because I know there's a question and answer period where I can address any of this in more detail, but because we're talking right now about getting patients aware and access, and this really does flow with that prostate cancer equity program, I think I'd like to turn it over to Dr. Stern so she can speak more in depth about that and provide more of a context on that aspect of our program.
Thank you very much. I appreciate your presentation. That was very informative. Before we turn over to Dr. Stern, I'd like to recognize a couple of people who logged on. Well, I'd like to recognize Senator Moore just logged on. So I'd like to recognize, I'm not sure if he and Senator Kennedy would like to say a few words or if they'd like to wait until a little later in the program.
I think we're still waiting for Senator Gopi is able to join us, right, Senator Moore?
I know she was supposed to, her aide said at 7, so I didn't know if something that came up. We can give her a few minutes, or if someone would like to send her a text. And
I
we'll
can
just,
reach out to her and we can maybe regroup in a few minutes.
okay, sure, thank you.
Okay.
So without further ado, this presentation, we put this presentation about probably 6 or 8 years ago. I met Dr. Stern. She was giving a presentation on prostate cancer at a NAACP meeting. Very, very informative. I learned a lot of helpful information. It gave me information that I can ask my physician questions about, myself when it comes to prostate cancer. As Dr. Sokolov said, she's a leading person in leading the fight against prostate cancer. It's an honor and a privilege for me to invite her, to have her here tonight to speak with us and educate us on prostate cancer and the tools that we have to fight against prostate cancer. So without further ado, I'd like to introduce Dr. Faye Stern.
Thank you so much, President Taylor. Mitch, thank you so much for your partnership. You are our main partner at UMass. President Taylor, you are our main partner at Worcester NAACP. We are also working with Community Health Awareness Network serving African immigrants. And I am really proud of our partnership. And I'm really proud of what we accomplished for Worcester County. We started a few years ago, 5-6 years ago, when Worcester County led the state in mortality, in prostate cancer mortality in Black men. Right now, according to the National Cancer Institute data, 2nd year in a row, they could not even count, thank God, enough Black men dying of prostate cancer in Worcester County to determine mortality levels, which is great news. So I'm really proud of our work. I'm really proud of our partnership, and I'm proud of our perseverance. I also want to express my gratitude to Senator Moore, Senator Gopi, who will join us, many representatives, including Representative Jim Day from Worcester delegation, newer addition to Worcester delegation, Senator Kennedy, for your support that made it possible for us to undertake such programs in prostate cancer. Traditionally, we had a series of public awareness and educational events of a kind we have today. But 1 year ago, we launched a new program, which we call Prostate Cancer Equity Program. And it's no longer only about education and awareness. It's about making sure that Black and brown men have equal access to high quality care of a kind that can be provided by Dr. Sokolov and his team at University of Massachusetts. We actually have put together an educational video for this event. It's actually became a part of policy for us because so many breakdowns across the state with PowerPoint presentation. And My presentation will be dedicated to description of the prostate cancer program and invitation, if you want, call to action for everyone, for every man in Worcester County, for every man who is loved in Worcester County by their women or anyone else, to consider joining prostate cancer equity program and access to facilitated access to the best in class, as Dr. Sokolov pointed out, patient care in prostate cancer. Emma, if you do not mind. My name is Faina Stern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading groundbreaking programs at the state, national, and international levels. Our programs have been transforming patient care and reducing health disparities. My thanks to Worcester NAACP for the partnership for this event. Dr. Mitchell Sokolov described recent advances in prostate cancer screening, diagnosis, and treatment. The focus of my talk is on our prostate cancer equity program, launched recently to bring these advances in patient care to every man in Massachusetts and eliminate health disparities. Prostate cancer equity program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. I'd like to express my gratitude to the members of the Worcester delegation to the State House who made this program possible, led by Senator Michael Moore and Senator Gobi. We also appreciate and more recent support from Senator Robin Kennedy. For public awareness and education, our messaging centered on the importance of screening and early detection, critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are about 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. For National Cancer Institute, between 2018 and 2020, Worcester County was the ground zero with the highest prostate cancer mortality rate in Black men in our state. In early 2019, we joined efforts with UMass Medical School, Community Health Awareness Network, Worcester NAACP, to increase public awareness with the focus on the highest risk, most vulnerable men. Between 2021 and 2022, we had seen a drastic reduction in Black men's mortality in Worcester. The centerpiece of AdMeTech's medical education is annual global summit on precision diagnosis and treatment of prostate cancer. The latest 6th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for prostate cancer care. Our summit brings together the key international experts representing every clinical expertise involved in patient care to review the best emerging clinical practices. Summit 2022 showed rapid advances in patient care. In screening, our summit supports clinical practice guidelines recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and their leading experts. High-risk men, including individuals with Black heritage and with family history of prostate cancer, are recommended to start screening with PSA blood test at the age of 40. Average risk men should start screening at the age of 45. this first, or what we call baseline screening test in younger men, has emerged as one of the most important indicators for identifying men at risk of lethal prostate cancer long-term over more than 10 years. In diagnostics, we have seen emergence of very accurate non-invasive tools such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, and molecular imaging. This non-invasive diagnostics highlighted the importance of PSA screening and shifted past concerns about screening into a dustbin of history. For example, these diagnostics can determine which individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection, critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized care for each man, including careful observation, what we call active surveillance, minimally invasive interventions, or immediate radical treatment. High-risk individuals, including Black men, carry higher risk of both mortality and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics such as advanced imaging, MRI or molecular imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any non-invasive testing is available to determine if these procedures are actually needed, and if yes, what kind of options would work best for him. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care. Supporting organizations include Latino Health Insurance Program and NAACP New England Area Conference, with their multiple branches located across the state. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. Any Massachusetts man age 40 and older can take part. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of prostate cancer to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of 3 components. First, AdMeTech Foundation Administrative Coordinator collects basic information and matches individual patients' needs with the experienced nurse for patient education and the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator who works with multiple schedulers to expedite a medical visit and related needs, including registration into healthcare system, transportation, and financial assistance if needed. Third, if an expert recommends any next steps, AdMeTech's coordinator, educator, and patient navigator work with patients on the appropriate follow-up, such as, for example, testing or treatment. Trisha Kinney, a member of the AdMeTech Foundation staff, serves as a statewide coordinator and initial contact for the Prostate Cancer Equity Program. Latino Health Insurance Program, our community partner, helps men to obtain health insurance, such as Mass Health, if needed. If you have any questions or need assistance, please contact Trisha by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention. President Taylor, should we turn it over to you?
Yes, thank you very much. That was a really good presentation. Before I introduce the folks who just came on, I'd like to definitely give recognition to your team. I'd like to give a shout out to Thomas, Emma, and Trisha. I definitely want to give you guys a shout out. Thank you very much for helping us put this together. I really appreciate it. We really appreciate it. Thank you very much. At this time, I want to welcome, thank you. I see State Representative LaBeouf joined us. Thank you very much, State Rep LaBeouf, and also Senator Goby's here. Thank you very much for joining us. At this time, I'd like to just pass the ball over to Senator Moore.
Thanks, Fred. Thanks everyone for being here. I'm here today to recognize Fred Taylor for his selection as a 2023 Black Excellence on the Hill honoree. Senator Goby, Senator Kennedy, and I, and Representative LaBeouf, nominated Fred for his work as a pillar of the community. Fred Taylor is a proud Worcester resident of over 40 years and a graduate of South High. He and his wife, Karen, have 2 grown children and 2 great-grandchildren. Fred was a homeowner in the Boys and Girls Club neighborhood of Maine South for many years before moving to the east side of the city. Fred is a constant presence in our community, and he currently serves as the president of the Worcester branch of the NAACP. He's a core member of Black Families Together. There's a long list of activities that Fred is involved in here. I'm surprised he has time to do everything he does, as well as a committee member of Worcester's Black Heritage Juneteenth Festival, the city's annual celebration for the people and cultures of the African diaspora. In his role as a Worcester Community Labor Coalition representative on the Worcester Jobs Fund Board, Fred oversees equity and diversity initiatives. Fred is also the chair of Worcester's Construction Diversity Monitoring Committee. That's not it. I'm not done with everything Fred does. At the state level, Fred was appointed to serve as a member of the Law Enforcement Body Camera Task Force representing the NAACP. In 2020, the task force sent recommendations to the legislature regarding best practices for the procurement and the use of body cameras for police officers in the Commonwealth. Fred also currently serves on the Governor's Advisory Council on Black Empowerment. In addition, Fred serves on the Board of Directors of the Maine South Community Development Court, which participates in the promotion and production of affordable housing, economic development in Maine South area of Worcester. A proud member of the Carpenters Union since 2000, Fred is employed by the North Atlantic States Regional Council for Carpenters. His primary coverage area is Worcester County, and he serves as a business representative / organizer with the Worcester office. Fred advances the NAACP's agenda locally, and in the coming year, he intends to lead efforts to create a civilian review board of police oversight on the ongoing campaign to diversify the leadership and teachers in the Worcester Public Schools. Fred and the Worcester branch of the NAACP will continue educating the community about the new school committee districts and election system. Senator Goby, Senator Kennedy, and Rep. LaBeouf and I have recognized Fred Taylor for the work he does for his community and the state, noting that Fred always acts not for the recognition, but for the good of the people of the Commonwealth. Congratulations, Fred. And actually, Fred, I do want to say your wife and family deserve an award for all of the sacrifices that they are making by letting you serve and do so much for the community. Congratulations.
Thank you very much. Thank you. Wow. That is a lot when you read off and you say all that stuff.
Yeah. So it's a mouthful.
Yeah, it is a lot. But that's all right. I don't do it all by myself. I don't do it for accolades and rewards. I do it because, like you said, I really care. I want to make change. I want to make positive change. I want to be honest about making positive change in our community for everyone. I say the word Black because I'm a Black man, right? It's no hiding. It's not anything that I could get away from. I am who I am. I advocate for our people, but I want to be clear. I love all people, Black, white, Asian, Hispanic. My wife is on the line, the love of my life. This year is going to be 35 years since we started going out. That's a long time, and I definitely want to give her a shout out because you're absolutely right. She loans me to the community. She loans me to the community. She puts up with me being absent. Some of the stuff I do must drive her crazy. I appreciate everything she does for me. And that's why I'm here. That's why I'm able to do what I do. Although I get this award, I definitely have to split it with her, my wife, because she's my rock that keeps me standing. Thank you for the award. And thank you to the team at the NAACP. I don't do this alone. I said it before. There's a lot of people who help me, people in the community I speak with. The Carpenters Union, it's the greatest job in the world working for this organization. They support what I do. If I didn't have my step doing that, it wouldn't put me on the platform. So I think that everything I do leads to the things that I'm doing right now. And hopefully I can continue to do greater things to make Worcester and the state of Massachusetts a more perfect place. Thank you.
So again, Fred, thank you. And again, you are one of the, when this nomination came up, you were one of the first people thought of. And that's because of all the respect we have and all the work you do. And thank you, Karen, for lending him out to the community.
Right. Thank you very much. So with that being said, I'm sure that those are some really interesting things we heard about breast cancer and also about prostate cancer. So at this time, we want to take a few minutes to allow people who are interested in asking any questions that you may have to any of the panelists that spoke today about any of those subjects. Does anyone have any questions? I have one. I have a question about. I have a question for Dr. Stern or Dr. Sokoloff, whichever one of you that would like to take it. Prostate cancer. So I know as a male, going for your physical, and I know a lot of men who go for their physical. A lot of times when I met you 8 years ago, I learned about the PSA test. And since I learned about that, I always have my doctor do a PSA test a week before my annual physical. So they'll have the results before my physical. But I want to ask you, for men that are on the line, and I want to ask you for myself, there's different ways to test for prostate cancer. One of them is the PSA test. Another one is probing. My question is that necessary with the PSA test?
And that's a great question. I like the word probing. I feel like I'm a UFO or
There
something,
you go.
some interplanetary alien. The PSA blood test is by far the most sensitive of the screening tests. Not only not necessarily as a single test, but looking at trends and looking at changes in values over time. And I agree, when I see patients, and I routinely follow patients both with and without cancer, we get the PSA blood test in advance, so we have it available to us, so we can discuss it right then and there. The digital rectal exam offers some information. It's interesting, the urologists were kind of the last bastion of those who were maintaining the exam. I was just at our national meetings in Chicago just last week or 2 weeks ago, and fewer of my urologic oncology colleagues are sort of incorporating it, saying it doesn't give as much information. I still think that there's information to glean from it. I am sort of an older dinosaur in the field of urology now that I'm almost 60, but and I still maintain it's an important part, but it's not as important as the blood test, and there are now some urologists who are declining to do it.
All right, thank you. So thank you very much. I saw Leslie's hand up. Oh, so I want to say this. Nakia Clark, she was literally at the airport in her car when she was giving her presentation. So she had to leave because she had a plane to catch. So unfortunately, she's not on right now to answer any questions related to breast cancer support, but she left her phone number and an email in the chat. So if anyone has any questions, they can just reach out to her and she can answer them. Thank you. So Leslie, I'd like to go to you if you have a question.
Hi, I'm Leslie, member of the NAACP. My only question is, I'm fairly young, so I'm not necessarily dealing with any of these issues necessarily right now. I'm 22 years old, but is there any hints or clues or something I could share to the youth, to kind of prevent or actually keep these things in mind? I know working out every day, eating healthy, eating right should help, but is there anything that you could suggest?
So I was going to say exactly what you just said. Exercise, working out, good diet, all the things you would normally do just for general health is going to be the best thing to do at this age. I would say just an awareness. I mean, it amazes me even how many people I see in their 50s and 60s, and men don't even know what the prostate is or what the function is. It's sort of a foreign object to them. So maybe I am a interplanetary alien in that sense. But I think just letting people know that there is an organ, especially in the Black community, that eventually you're going to want to think about. But even more importantly, 22 and 25-year-olds have fathers and grandfathers and uncles, and making them aware could help spread the word to their other relatives who might not be aware, saying, hey, Dad, you're 55, you're African-American. I just heard that, prostate cancer is sort of endemic among the African-American community. Why don't you talk to your doctor about getting screened? And that's probably the best thing you could do if you're educating your peer group to make sure they're educating their parents and grandparents. I think that would be extraordinarily useful and helpful.
Thank you. I was going to say, for myself, at 18, I kind of had a scare in that department, some medical issue. And I was terrified, and I was like, what's going on? And I was doing construction at the time, full time. So I was like, did I stab myself? What's going on? What happened? And then when I went to the doctor, I had actually had my first prostate exam at 18, which is really weird. It was a really scary experience. So then from that moment forward, I kind of was like, it's a sensitive topic to bring around and mention kids my age or guys my age. And they're like, oh, what are you talking about? That's kind of strange. I'm like, nah, we need to keep that in mind. And from further joined the NAACP and having these people come in, and I was like, okay, this is something that's actually serious and could actually take a huge toll. So thank you for that.
Absolutely.
So Leslie's also an executive board member for the NAACP also.
Yeah, Leslie, you're very young. Prostate cancer screening works when it starts around the age of 40. But you may have friends, you may have relatives, you probably have father or brother or uncle. If they're 40 and older, please talk to them and please ask them to take care of themselves and do exactly what President Taylor is doing. He's a great model. If their physicians are not offering PSA testing, please ask them to talk to them about it and to request it. And if their doctors are not willing to provide PSA screening, please come to us. Trisha, are you here? Trisha Kinney?
Yes, I'm here.
Okay. Trisha Kinney is our coordinator, and she can be reached at 617-523-3535. Trisha, please put your contact information in the chat room, and we will take care of your relatives and friends with great pleasure, and we'll make sure they will not fall through the cracks.
Thank you so much.
So the PSA test, that's a blood test. She probably said it earlier, but some of you may have missed it. It's a simple blood test. So, when you go for your physical, most of the time, you have to get blood work done anyway. So you can just ask them to do a blood screening, a PSA test when you're going for your physical. Earlier, I used the acronym. I met Dr. Stern at NAACP. Some of you may not know what NAACP is. That's our New England Area Conference. That's our parent of the NAACP. It's almost like federal government. So we have national NAACP, which governs the national NAACP. There's over 2,200 units of the NAACP in the United States. And then we have a state body, which is NAACP. So when we say NAACP, New England Area Conference, that's like our state government. And then we are the NAACP 2058. So we're basically like city government, like the city of Worcester. That's how you break it down so that people can understand the different branches of our government. I just wanted to make sure I just explained that because some people may not have known that. Do we have any other questions? 1, 2, we have these professionals online. We have them here at our disposal. We do have contact information if you want to reach out to them afterwards, but you have them right here live and direct. And if you're thinking something, the good thing about asking questions in a group, it could be something someone else is thinking about or didn't think about, and can answer their question as well.
Can I comment, President Taylor?
Sure.
Okay, thank you. What I want to emphasize is the critical importance of prostate cancer screening with blood test PSA. Early stages of prostate cancer in dominating majority of men absolutely have no symptoms. So it's extremely important to do screening with blood test called PSA, starting at the age of 40 for Black men in particular, or for any man with family history of prostate cancer. And the earlier we are able to diagnose prostate cancer, the less invasive treatment that can be administered in most occasions. So prostate cancer is like breast cancer. It's not, it impacts so many men and so many families. It's not, we cannot keep our heads in the sand. We want to make sure that men are tested starting at the age of 40 every year, so that we will diagnose prostate cancer early to save lives and to make sure that men will get as minimally invasive treatment as possible. Mitch, do you want to comment any last minute take-home points?
Yeah, I think it's the awareness and the education. There are resources once you know about prostate cancer throughout the state, especially as your Worcester and points east of that. And with all of the cancer equity program and all of the resources for that, there's really no excuse that someone can't get in to see us if they know about us. So it's really getting the word out that prostate cancer is an issue in the underserved populations, men of, Black men, brown men, what it is and what we can do to help navigate through the system. I think those are probably the most important messages to get out.
Thank you. And I just noticed that Trisha Kinney shared her contact information. If you have any questions about prostate cancer equity program, if you would like more information, please do not hesitate to contact Trisha.
Any other questions? Going once, going twice. All right, I'm not going to do like Diamond for Dolls. I'm not going to count to 10. Some of you folks on the call are old enough to remember dialing for dollars. Well, I just want to thank everyone for, well, first, let me thank the panelists, thank the elected officials who took time to join us tonight. And again, thank the panelists and thank everyone for taking time to come and listen to this really important presentation. There's contact information again in the chat. If you didn't capture that information, you'd like to get the information, you all know how to reach out to us, NAACP2058@gmail.com. You can reach out to us and we'll connect you with anyone. Thank you very much, Leslie, for asking the question. Really good question. I just want to say thank you. And that's it. That concludes our program. I'll see some of you folks in a couple of weeks, if not sooner, at our regular meeting.
Thank you so much.
Thanks.
Dr. Taylor.
Thanks, Fred.
Yep.
Great
Thank you,
program.
Fred. Congratulations.
Thanks for a great
Thank
program
you.
and
Yeah,
congrats.
take care. Thank you.
Thank
Thank
you.
you.